So one of the further analysis we did is we took patient information produced by the American Cancer Society, and we looked at that's written for patients specifically, and compared that and how that was written to the National Cancer Institute information for each cancer center. And we found that the American Cancer Society writes things at a much lower grade level for people to understand, on average around the 8th grade level. So it's possible to write this information in a way for patients to understand, and what we wanted to do is make sure that cancer centers are aware about this, because we want them to be a source of information for patients in every region of the country that they're at. Patients look to their local National Cancer Institute designated center for patient information, and we want to make sure that information is available for them to understand in a way that's helpful. And so I think that for a lot of these cancer centers, one of the ways they can improve this is by looking at the examples the American Cancer Society has put together and working with both literacy experts and other people to improve patient information they have available on their websites. I think there has to be a discussion. I think really there has to be a sit down and kind of seeing what type of information do we want to present to patients, and how should we present it, and there should be a lot of forethought going into that. So it might be a more slow transition as we kind of go forward and say to patients, what do you need to know and how can we present this in a way that's easy for you to understand. I think that's a back and forth conversation both with the community and with physicians as well, and other members of the National Cancer Institute and their designated centers. And it's important because we want these major centers to be a major source of patient information, rather than going to third parties where patient information might be a little bit different, I would say, compared to the major centers.